Hello and welcome back to Bears with Boobs. This is going to be my second video on my mom's journey with triple negative breast cancer, and this episode will be about her first 4 treatments of chemotherapy. She had a total of 8, and if you missed the beginning of where I explain her diagnosis, treatment, and the facility she chose, go check it out. Just to preface and give some recap, my mom was diagnosed with triple negative breast cancer in 2021, December 2021, and she started treatment in March. So I'm going to talk about her first 4, since the first 4 chemotherapy treatments were using the same type of chemotherapy, and then the same in the last 4 treatments. My mom's first 4 treatments were AC, Adriamycin, and Cyclophosphamide, and then her last 4 treatments were Taxol. So ACT for short. So before my mom got started with chemo, we spoke with a nurse navigator, and she gave my mom a couple of prescription drugs in case that she was experiencing side effects, mainly nausea. She was given olanzapine. She was to take bedtime and then the next 3 days when she received chemotherapy. So the day she received chemo, she would take the olanzapine before bed, and then 3 days consecutively afterwards. She was also given prochlorperazine, also for nausea if needed, lorazepam, also for nausea if needed. This is also used for insomnia and anxiety. And then also given a topical cream that was for numbing for her port, as well as recommendations for preventing constipation. A lot of the times people also feel constipated from chemotherapy, so there were some recommendations given to her then too. So my mom also decided that she was going to give Paxman a try, and that is a cooling cap system that helps save your hair. I can do a whole separate video on that later, but maybe I'll just kind of touch on it now. Paxman, unfortunately, did not work for my mom. I do wish that it was more, well, you really don't know how people are going to respond to Paxman and if it's going to save the hair. But I will say, from doing my own research, it does show that patients on chemotherapy who have doxorubicin or Adriamycin as one of their chemo drugs, it is not as likely for the Paxman to work. Again, my mom is a 64-year-old female, and after 2 treatments of doing Paxman, she decided to stop, and I do not blame her. It was just a lot more time in the chair when she already doesn't want to be in the facility. Like, after getting chemo, she didn't want to wait another hour to just keep her head cold. It wasn't the most comfortable, but the people at Paxman are incredibly nice and professional and kind, and I'm sure it does help with other benefits, like after getting chemotherapy, your hair growth comes back quicker. But I just wanted to touch on that a little bit. So after speaking with the nurse navigator and knowing all of the medications that she had to take, and we had them sent in to the pharmacy, she had to get her labs drawn a day before, or you can do up to a week before she was going to get chemotherapy. So her schedule was set up where she was going to have labs drawn before a day before chemotherapy, where they check her CBC, CMP, make sure her white blood cell counts are good, make sure her liver enzymes are good, so that she's at a good baseline before receiving chemotherapy. So the first day of chemo was a bit terrifying. My mom was obviously very nervous. I really didn't know what to expect. It's hard when you hear what other people are saying online, so everyone's kind of a ball of nerves. Even though I'm trying to maintain my cool, I'm also a bit nervous for this to begin, but I was happy that we're getting the ball rolling. So she came into the facility and they explained all the procedural things. I would say during treatment, it took about 3 hours in treatment at least. We had a wonderful nurse who was working with my mom the first day, and my mom was definitely had the shakes because of just being so nervous with receiving treatment. And then also this was when she was receiving Paxman. It was so cold on her head, so it was just not very comfortable, but she was doing it. So I would say after the first treatment, this type of chemotherapy, it really didn't have any true effect in the facility, like in office. I would say that was more Taxol, where they have to do a very slow drip because they noticed more of side effects in office with Taxol. With my mom, the one thing I can remember being in treatment with her was that, so anytime my mom was about to start the doxorubicin, they would already have a cup of ice ready for her to suck on, or you can get a popsicle. We tried that out. She preferred the ice, and just swish it around her mouth while they're putting it in so that it could prevent mouth sores from forming. We did some naturopathic care prior to my mom coming to the first treatment, and that was doing a glutamine wash, also for the same idea, to prevent mouth sores. So that was one thing that we did do to make sure and try to make sure my mom's mouth was well coated and moist and not super dry from that could be a possible side effect from chemo. Other naturopathic things that we did prior to chemotherapy was vitamin C, the glutamine for the mouthwash and gut protectant, vitamin D. Doxorubicin is also known for possibly causing some heart problems. I had my mom take a cardioprotectant herb called hawthorn, and then I had homeopathic remedies specifically for bone pain and nausea ready to go, just in case my mom would experience any of those side effects too. This is not medical advice. I would seek out a medical professional and talk to your oncologist about this. Thankfully, our oncologist was open to naturopathic treatments and care, but she just did not want anything to do with it. She was like, if you have someone who's managing it, no problem. But we always did, we did talk to the nurse practitioner about it and kind of gauge what she thought. And, we would listen and see like what would be suitable for my mom and what we felt comfortable with continuing. The day after my mom received treatment, she would get an injection of, I hope I'm not completely butchering this one, but it's Dextenzo. That was specific for increasing my mom's neutrophils and white blood cell count, since the chemotherapy treatment that she was having in the first 4 were known to decrease them. So this injection was to help with increasing them and putting them at a high number so that my mom's immune system would still be at a good baseline and like ready to fight and prevent infection. That was the point of this shot. However, this shot, I think, caused a lot of side effects for my mom. I felt like it was hard to say because it was right after chemotherapy, but the moment she had the shot, literally that evening, she would feel achy bones. So what this shot is doing is pulling from the bones so that it can increase the white blood cell count. When my mom would get home that afternoon, if she got the shot in the morning, by late afternoon, she was feeling pretty terrible. And then within the next day, it was not good. My mom had bone pain. My mom felt achy. She just felt not like herself at all. It was honestly miserable. I know that a lot of people, or there are people who choose not to do this type of treatment for that reason. The doxorubicin and cyclophosphamide is a difficult chemotherapy to go through. And with my mom, I felt like she didn't really experience the nausea that they gave her multiple medications on. She did take the necessity, which was the olanzapine, before the day of chemo and then 3 days after, but she never had to take the prochlorperazine. The nausea really wasn't a problem. The bowel movements were not a problem either. My mom had consistently good bowel movements, but we also had her take a good fiber supplement to just keep that going. So I think what was the worst as for side effects, which was a combination of the chemo and the injection, was the painful bone aches, the flu-like symptoms, and just feeling beyond exhausted. And she would feel this way for the next couple days, at least until I would say 1 week after. So the first 3 days after the shot, she felt pretty terrible. And then by Tuesday, she would feel more like herself again. So since her treatments were every other week, she did have a week where she felt fairly okay, but I could tell that my mom was still off. It wasn't until after the first 4 treatments did they suggest my mom get hydration, which I think was her saving grace. So my mom didn't get hydration bags, so pretty much it's saline bags for her because she didn't want to drink water. She pretty much endured these side effects of AC and the injection while feeling super dehydrated. And I would highly recommend, if possible, to talk about this to your oncologist or to the nurse practitioner if you could get saline bags after chemotherapy, only because it did nothing but help my mom. It helped her feel at least hydrated post chemo if she wasn't able to even swallow or drink water. And we didn't figure this out till midway, so that would be a huge tip for me to share with you, to try to get hydration bags and see what they say about that. So another thing that really helped my mom during these first 4 treatments was acupuncture. I am a naturopathic medical doctor and learned acupuncture in school, and also am a future doctorate in acupuncture as well. So I was able to be of assistance to my mom with that and helping her mitigate some side effects with acupuncture. I think that it did help greatly because there are sometimes she really did not want to take the medication of trying to alleviate pain. My mom is really not big on medication, so I did everything I could to help mitigate those side effects naturally, and that was the fatigue, the bone aches, and the flu-like symptoms. I would also say homeopathy was a huge help, and we used eupatorium, which is known for flu-like symptoms that also present as like bone achiness, and then ipecac was for the nausea. And then we had some other homeopathic remedies on board, mainly for my mom's emotional state, and I think that helped her greatly as well. To summarize, the first 4 treatments were the toughest out of the 8. I will say that my mom's main side effects were fatigue, flu-like symptoms, bone pain, likely from the injection, and also like just overall feeling so miserable. Her appetite decreased significantly, and she was losing a lot of weight. That was what I was most fearful about seeing with my mom, was the weight loss. Her hair did come out completely. We did shave her hair. The Paxman did not save that. But my main concern was my mom's weight loss. She started out being, I'd say 114, and then got all the way down to 104. My mom's small, 4'11", so 10 weight decrease was huge. She also had shortness of breath going up the stairs, so doing any form of exertion was also a lot for her. She walked minimally, maybe down the street and back because we have a dog, so I tried to encourage her to do that, but some days she just didn't want to. She was up and moving around the house, and I wanted to make sure that my mom's mental state was good and that she was doing something mentally exerting as well, and she would play Wordle every day. So this is her new thing. She loves playing Wordle, she likes puzzles, and I think that was something that I had in the back of my mind too, where they talk about side effects of chemo brain, more around the cancer community versus the oncologist really talking about it. That was something that I really wanted to make sure my mom was continuing to do, was to stimulate her brain and keep her active even if she couldn't move so much. So I would say it did take about a couple of days before we passed the hump of complete misery, and then by a week she was getting back to normal. I can't say enough how I was so excited for my mom to be done with this first 4, because it just compounded upon each other, and by the 4th one, I just felt like there's no way my mom could continue with this treatment combination. It just felt like they would have had to titrate it down. The combination was too much for her. Halfway through treatment, she actually met with the surgeon. The surgeon wanted to see how she was doing, kind of get a good basis on like, is my mom responding to treatment well? So my mom had an ultrasound, and this was supposed to be like the happiest day of the journey thus far. I mean, she did an ultrasound. They saw that my mom's tumor had shrunk more than 50%, a little bit more than 50%, which was huge. But my mom came a couple days after chemo and was just not well. She took her vitamins in the morning, which I do not recommend. I feel like if you have vitamins on board in your treatment, I would take it midday. I don't think that my mom's body was up and ready to take those types of meds. So she was like throwing up in office. The surgeon was honestly concerned, and as were me and my sister when we were in office, that my mom was not looking well. So she had the oncologist meet with my mom right away. And that was something that was really important, I felt, for my mom to meet with the oncologist, even though I felt that the nurse practitioner was so wonderful to my mom and speaking with my mom really wanted to have that rapport with the oncologist. So when my mom didn't see the oncologist until this after the second treatment, I think it did bother her subconsciously or even consciously not talking about it. So that meeting was necessary. My mom needed to hear that things were going as planned, to keep going, to try to stay resilient. Any words of encouragement was really important for my mom. Those treatments were definitely tough. Throughout the whole time, my mom's labs were great. Her white blood cell count and neutrophils and all of that remained high, and that's the point of the injection shot. They wanted to keep it high so that there wouldn't be any dip below an amount that they wouldn't be able to continue treatment. It worked, and I did ask them, like, okay, my mom's lab values of the white blood cells are so high, is it even necessary because for the injection? Because I felt like that was what was causing a lot of my mom's aches and pains. And she said yes, it was necessary. They didn't want to risk the option of it going the other way. So my mom did continue with the injections after chemo all through the first 4 treatments. Something that also helped her, which I felt helped her, it was so interesting because I would see things so differently from my mom. I could totally see when my mom would have improvements. But because my mom's just miserable, there's really no like more miserable or less miserable. She's just miserable. So even if I see that my mom's a little less miserable, she's still going to be like, I'm miserable. But I did find that in the beginning, I was more averse to giving my mom over-the-counter meds if not necessary. By the beginning of treatment, that is. By mid to the end, I was like, you know what? Chemotherapy is just a whole nother ball game. I'm just going to throw whatever is necessary to keep my mom out of pain. And that was my mentality. So when they initially told us to try Claritin to help mitigate the flu-like symptoms from the injection shot, I was like, yeah, we'll see how that goes, like if that is necessary. By the second time, I was like, this is necessary. Let's give it a go. I feel like I will do anything to help you try to get out of pain or alleviate the pain as much as possible. So we did have her take a Claritin before the injection shot, and then that night and we continued it a couple days after. And you can ask the oncologist or your nurse practitioner what's the best regimen for that, and they were very up in the air about it. So we did it 3 days after, continued it, and I felt like I saw a change in my mom's the flu-like symptoms and the bone pain. If you were to ask my mom, she would be like, it was very minor, but the way my mom was up and about, I felt like it was more significant than that. I guess I can kind of give you a walkthrough of our day going to treatment. So my mom's treatment time was normally either at 10 or 10:30. That means if it is 15 minutes away from home, my mom and I knew we wanted to be there 30 minutes ahead of time. So say her treatment was at 10:30, we better be ready at 10. And then to put the lidocaine cream on, you need at least 30 minutes to an hour before you go to get treatment to have it on the port. So I would put the medication on at 9:15. We would leave the house at 9:30, and we would get there by 9:45 for my mom's 10:30 treatment. We were always so early, hoping that we would get in earlier. And a lot of times we did get in earlier. They were already ready to go and prepared. And then at that time, they would have my mom's pre-meds ready to go, which was mainly nausea medication and probably some other things prior to the cyclophosphamide chemotherapy. And then midway, they would add the doxorubicin, have the ice, swish, 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 make sure that it's nice and moist. And then once she was done with the cyclophosphamide bag, we would be home by, I'd say 2 o'clock, 10, 11, 12, 1, 4 hours. 4 hours seems about right. And then we would go home. I would have my mom mouthwash the glutamine again for keeping the mucosal layer of her mouth nice and moist and free of possibility of getting mouth sores. And then she would eat. And I would really try to encourage my mom to eat as much as possible. That was hard. I think the lack of appetite was one of her biggest side effects from the cyclophosphamide and Adriamycin. I was just on my mom about eating. I think that the weight loss, a huge contribution to that was the dehydration, because chemotherapy is incredibly dehydrating. So again, if possible, I would suggest talk to your oncologist and nurse practitioner to see if it's possible to get hydration bag schedule for at least 2 days in a row after chemo. My mom was able to get 3 days after, and I think that was significantly helpful with her last 4 treatments. So that is all for this video. I hope I wasn't rambling too much and that you had some use to this video and enjoyed it. Please email me if you have any questions. If I missed out on anything and you wanted more clarification on it, I will do my best. And I'm wishing you all the best and sending all of you lots of love. So thank you again for joining, and I will see you next time where I talk about my mom's last 4 treatments of chemo.